Good morning. We are on location with Aimee, Cassie, Executive Director of the Spirit of the North
CEO of
Healthcare
Spirit of the North Healthcare Foundation.
CEO of the Spirit of the North Healthcare Foundation. Aimee, it's great to have you on the podcast.
Thank you so much for having me. Excited to be here.
I'm excited too because I only recently met you, and like all my guests, I only recently met them, but I know a lot about Spirit of the North, and it seems like every time I work with somebody from there, I learn something new. And it's a huge organization. It's way bigger than I expected.
Yeah, it's surprisingly big, and the work that we do is actually quite surprising.
And it's really important.
It is.
That's one of the things I like about these local community. It's just an organization. It's not a business, right? It's just an organization.
Exactly. Yeah. So we're a nonprofit. So we work to, how I describe it to people is, we work to bridge the gap for funding. We know that the provincial government doesn't cover all of the medical equipment and programs that we need right across the province, but our aim is to focus specifically on Northern Health, the Northern region, the same area that Northern Health covers. So we cover Prince George. A lot of what we do is in Prince George, but then we also service all of the communities surrounding Prince George, basically the northern half of the province. And so we get to come in and bring in and work with our donors to bring in and fund medical equipment that otherwise wouldn't be in these communities. And a lot of that work is advocacy, pushing to bring different services to our communities, and making sure that people in the north have the level of care that they deserve.
Yeah, it's really important. And it's nice to see the community, like how involved the community is, like to kind of take over where, like, I don't want to make this political, but where like government falls short, right?
Yeah.
Like we should have all the equipment we need up here, but it's the community, it's the people up here that are making it possible.
It absolutely is. I think that's one thing that that we can say time and time again about Northern BC, about Prince George and all of our communities, is that we see the gap and we work to close that gap. They did it with the opening of the cancer clinic years ago. Now we're getting world-class cancer treatments in Prince George, and that is servicing all of the north. That is huge. And so we've got some big work ahead of us, some significant gaps that we need to work to close. But I have no doubt that the tenacity, the determination, and the passion of the people from the north, we will close those gaps that need to be closed and bring that very best in care to all of our communities and closer to home. A lot of the things that we do with Spirit, people can direct where they want that funding to go. So we're always working on big pieces of equipment, but people have the ability to say, cancer care is really important to me, so I want to do something that supports cancer care at UHNBC. And we work with the teams on the ground to look at what equipment is needed. And then we work to support that equipment. So right now we're, for Spirit Day that's coming up, we're working on a liver retractor. So that'll be a new service that's offered in Prince George for cancer patients, for people that are facing pancreatic cancer, liver cancer, people that are requiring Whipple procedures to be done. This will be a new piece of equipment for the region, and it's got a hefty price tag on it. I believe it's just over $90,000 for the piece of equipment, but it'll have a huge impact on the capabilities and what we're able to do in the north.
Yeah. So when a new piece of equipment comes, I guess they need to bring trained technicians and staff.
It is. So that's one of the, so we work really closely with Northern Health. We're not funded by Northern Health. We are not government funded. We are totally funded by our donors. But what we do is we work in partnership with Northern Health. So yes, you can get a great piece of equipment, but you need the staff to operate it. So we always work in partnership with them to make sure that the piece of equipment that we're bringing in, yes, they have staff to use it. So the liver retractor, for instance, there's 2 new surgeons coming to Prince George, and they will be the ones that will be using that new piece of equipment. So it's kind of this ongoing conversation to see what the needs are, what staffing levels are at. Can we fill this gap? And then we work to bring that equipment here. And it just, I think, we look at putting tools in the hands of healthcare professionals. That is our aim, is to make sure that they have all the tools necessary to bring that very best care to our patients right across the region.
Yeah. What is it about Prince George that makes it so difficult to get surgeons and people here? Because I know that's
a tough one. I think, I think the remote communities it's a struggle. But I mean, I would argue it's I would say. I mean, born and raised in Prince George, I think it's the most beautiful part of not just BC, but part of Canada. I mean, we live in the most unique and beautiful part of the country. But one of the things that makes us really unique is how the distances between our communities, they're so vast. So we don't face the same issues that they face down in the Lower Mainland, where, you know, Surrey is relatively close to North Van and White Rock, and they're pretty close. Where in the north, we've got huge length of travel between our communities. So we have to think outside the box. One of the things that we did last year that I think was really cool was a mobile ultrasound program. So thanks to one of our funders, one of our donors, we were able to purchase 3 mobile ultrasounds, and those ultrasounds travel with from sonographers that are based in 3 different communities across the north, but they travel into our very remote communities to bring diagnostics, so ultrasounds, to these communities that otherwise wouldn't have them. And so they're on a rotation, and it's just it's a way for us to think outside the box. And, you know, an ultrasound is a basic first line level of care, and this is a way that we can bring that basic first level line of care to our communities and work with the distances between them. But it's a challenge that we face up here all the time.
Yeah. And you're right, like, it's a basic piece of equipment. I didn't think that they wouldn't be everywhere.
Neither did I. So when I started at Spirit, I had no idea that not every community had ultrasounds. So when they were talking to us about this program, I kept questioning, well, don't we have this in these communities? And no, we've, you know, there's not ultrasounds in all of our communities. We don't have sonographers in every community. So this is a way that we can work within the problem that we've currently got to work to solve it right away. And so this program is working really well, and one of those things that we're really excited about, and just I think a little bit innovative. I think it's a model that we can take into a lot of other pieces of equipment that we do. How do we make this something that's mobile, that can go to these different communities where we may not always have a sonographer, we may not always have this specialist? How do we bring them to these communities?
Mm-hmm. Well, okay, there's one piece of equipment I know you're really passionate about getting in Prince George. PET scanner?
Yes.
Yeah?
Yes. So prior to working with Spirit of the North, I was with the Canadian Cancer Society, and I lost my mom to cancer. And so for a lot of years, I fundraised for places like Quarterband Lodge, which are incredible. I mean, they just do incredible work and provide a home away from home for a lot of our families that have to travel. But cancer touches so many lives, and mine is no different. And I think if we can bring a PET scanner to Prince George, we're saving a lot of people that level of travel. We're saving a lot of people wait times, significant wait times. And it's something that is a dream of ours to bring here one day. Nothing is concrete. Nothing is in the works right now, but it's definitely something that we've got on our radar that we really want to work to bring here.
Okay. I have no idea what it is, Fiona.
Yeah, so it basically supports radiation, to make sure that they're doing radiation in the exact spot where they need to be doing the radiation. And you know, again, if you live in a larger community, they've got them in Kelowna and they've got them down in the Lower Mainland. It's you know, you're on a wait list still, but you go in, you get the scan done, and then figure out from there what type of treatment you need for your cancer. In the north, our patients are going through, as everybody, going through a really trying time, but then they have to figure out, okay, how am I getting down to Kelowna? I have to take time off work. I have to figure out my travel down there. I have to figure out my accommodation while I'm there, and then I have to get back home. And for a lot of us, we're very fortunate that we can figure those things out. But so many families and so many patients in the region are not in that position. It's, you know, financially, it's just not possible for them to do it. And so that's something that we really need to bridge. That's a gap we need to bridge. So that's my one day, our dream is to bring a PET scan here.
Yeah, yeah. There's another important piece of equipment I'm surprised isn't here, because I had two family members just this year had to go down to Kelowna for the angiogram.
Yes.
Yeah.
Cardiac care. Yes.
And it was crazy because both of them, it was like it happened. Like they had to book the trip, book time off work,
Yeah.
drive down to Kelowna, and 20 minutes later they were done.
It's wild. It's
Yeah.
So we are the only healthcare or health region that doesn't have interventional cardiac care. So all of northern BC, we don't have that interventional care. So one of the things that we are passionately working towards is bringing an interventional cardiac space to Prince George. We've done a lot of work with cardiac care over the last 4 years. It's been our primary area of focus. So we were able to open the first cardiac care unit at UHNBC. I always say to people, it's in its infancy. It's like planting a seed, and we've just started to grow that department. So it's an area where all of our cardiac patients are cohorted into one area under one team. That's a big step forward for us. So we were really, really thankful to be able to equip that unit. So that was just over $1 million in funding. But that's the first step. We've got long-term goals of bringing that interventional cardiac care, being able to do angios locally in Prince George. Right now, a patient is coming from Prince Rupert after a heart attack or cardiac incident. They're triaging in Prince George, and then if a bed's available, then they're going down to St. Paul's, Victoria, or to Kelowna. Yeah. And the North doesn't hold a bed, so there's not a bed that's always held for northern patients. It's when a bed is available, we can transfer patients down. And again, summertime, okay, that's doable, but wintertime, you get winter storms. We can't fly, certain times things are grounded. We can't medevac patients down. It's a big issue. And for Northern Health to be the only region that doesn't have that level of care is it's disappointing. And so it's one thing that we are really working to close, and that is one of the focuses of the acute care tower that's coming to Prince George.
Yeah, that's pretty exciting. That finally, right?
Finally, we need it.
yeah. And it's still going to be years and years away. But
it's a huge investment in the North. It's a huge, massive endeavor. But the areas that it's going to serve, I think there is huge gaps in care that we need to start working to close. It's going to be a long time, but everything is starting to build up to that. We've got our first team of cardiac nurses that are graduating that will be working on the cardiac care unit that we've currently got. And again, it's planting the seed. It's that first step. And we've got to start. And so really excited that we've started there. But we've got long-term goals in mind, and want to keep patients here. We got to keep them in the North.
Yeah, for sure. And even going from, Terrace to Prince George, you are staying localer, but you're still so far away.
You're still so far from home, so far from your friends and family. We personally, my father-in-law he had to have a pacemaker inserted, so he was treated at St. Paul's, and they do phenomenal work at St. Paul's. And I believe it was January, and so they medevaced him down, and my mother-in-law flew down, and then he gets the pacemaker put in, and he's discharged, and they are down in Vancouver with no vehicle to figure out, how do we get home? What does this look like? So, we were lucky. My husband took some time off work, drove down, and then drove them back. But they're driving through the canyon in the middle of a snowstorm, and it's not ideal. And that is something that so many of our patients in the North face. And so we've really got to make this happen. We don't have a choice. We need this. I think, when they opened the cancer clinic here, for so long it was said that, they can't do these type of treatments in the North. It's not possible. Well, now they're doing world-class cancer treatments at the BC Cancer Agency in Prince George, and that's phenomenal. Mm-hmm. Our next biggest gap is cardiac care, and it is a continuation of that cancer clinic, of making sure that we are bringing these levels of care that we deserve in the North. And so we have to do a lot of advocacy for it. And you'll probably hear us talk all the time about the need for cardiac care. And we will keep saying that that same thing until we've got this gap closed.
Yeah. Yeah. And for me, being male and being likely, like, I do need to think about that. Right?
Exactly.
Yeah.
And the timeframes, I think, quite often people don't realize that when we're sending patients down to St. Paul's and to Kelowna and Victoria and Vancouver, the wait time. So the wait time for a patient down south is significantly less than the wait time for a patient in the north, because in the north, we're triaging here in Prince George and waiting for a bed to open up, and then we're transporting down.
Oh.
If a patient comes in during that transport, they will get that bed. So because we don't hold a bed in the north for cardiac or down south for cardiac patients, we have to wait for beds to open. So that length of time is concerning, very concerning.
Wow.
And so, we're just starting to dive into, for Spirit of the North, we're just starting to dive into, okay, what does this look like? Because we want to tell these stories, because we have to keep the pressure on. We have to keep making sure that with this tower that the pressure is on for that interventional cardiac care. We can't let off on this.
Yeah. And that was where an evening in India came in.
Yeah.
Right. That was huge when they asked people, to consider donating and get up, and I saw that lineup, like, huge.
It was those are, I think at all the events when they start, when you make the case and then you do the ask, like, this is what we're hoping to accomplish tonight. Mm-hmm. Prince George never ceases to amaze, just with the amount of people that put their hand up and say, yeah, I want to help the patients in the north. I want to help my brother or my sister or my father. That's I think what sets Prince George apart. That's what makes it so special, is that we're just willing to do whatever we need to make sure that we've got what we need in the north. And Evening in India was, I think, even when they were doing, they went through and asked, do you know someone that's had a cardiac incident? Have you had a cardiac incident? Do you know someone that's been hooked up to an ECG? They went through this series of questions, and I think it was like 3 questions in, everybody in the room, 300 people were standing up because they had been affected by cardiac. That's so telling in that space.
Yeah.
Wow, there's, this does touch all of us.
Another good time is the Festival of Trees.
Yes.
Now, I saw that this year. I hadn't seen it for a couple of years, and I don't know if that was because of COVID or...
Yeah, we went through, so it was canceled in 2020, COVID. And then 2021, it was, we had to do quadrants of people, because you could only have 50 people in a certain area, I think it was. So it's gone through went through, as everyone, did some COVID awkwardness with it, but we came back. We've only ever paused for 2020, and last year we came back we'd done an outdoor market, which was really cool. We had an ice rink out front with, or tourism put out the ice rink, and it was great. Russell AV had the big screens going out there with movies, and we had hot chocolate and different vendors outside. And then inside, of course, was all the trees that were beautiful. And it was really important for us to make sure that it was big this past year, because it was the 31st anniversary. And so I think after you do 30 is just a celebration in and of itself. Mm-hmm. But 31 was, okay, what does festival look like moving forward? And so we were able to tweak a few things and change it up. A couple of years back, we went down to a 5-day festival from a 10-day festival. And that helped with making sure that, this is our signature fundraiser. It's the biggest fundraiser that we do every year, really making sure that we keep those costs down, and bring in the most amount of dollars with festival. And yeah, this was great. And it's spring, and we've already got trees for next year. We've got the theme picked out. Volunteers are meeting. Warehouse is taking shape. Everything is moving towards this next November.
Yeah, that one's super cool, because just the trees are all so good.
They're all
good. So good.
Yeah.
And it's unbelievable the amount of work, because I've never seen a tree like that in anybody's house. Right. So you think you're making like an elaborate tree at home, right? And then
Yep.
you go out to festival and you look and you're just like blown away by even was it I shouldn't say the brand name, but there was a brand name with coffee cups
Yep.
all over
Yep.
it. And I thought that
beautiful.
looks so creative. Yeah.
These designers do some incredible trees. I learned my first year with Spirit. I did my tree after festival and it was like, no, it did not look good. So I do it beforehand now because I know I won't compare to what these designers do. They're amazing. But some of the ideas, some of the creative thoughts that they come up with, like I would never even think to make it a Christmas tree, and it's the coolest thing. So we've gone out. We're going to go with a Whoville theme this year, so we're really excited about that. Yeah, so Grinch, Whoville, lots of bright colors. It'll be super bright this year, and we're excited for it.
Yeah, there was a really nice Grinch tree. I think there might have been 2 of them.
Yeah, there was 2 really cool Grinch trees this past year.
Yeah,
and we were like, hey, we should have that next year.
So that's going to be the theme.
Yep. We'll do a Grinch theme. So you'll see lots of Whoville characters and lots of bright colors. Very family friendly. I mean, festival is all about bringing kids down and working with them in the children's workshop and doing the story times with them. And it's all about kids. And so we just want to bring smiles to everyone and help kick off the holiday season. Yeah.
Actually, that workshop it's important to you because I remember you asking me to come get a photo of it.
Yeah. So we had a longtime volunteer. Her name was Carol, and she passed away a couple of years ago. And she had always run the children's workshop. And Carol was just this quiet force behind festival. She had been on the committee since its inception. And Carol, she just set a bar, I think, that is just was incredible. And so we've got a plaque done up for her. We call it Carol's Corner. And it's where kids can come, and we've got storytellers that come in and read books to kids within the children's workshop. And it's just a really special area. I think, at festival, it's super busy. For us, it's 10 days of full out running, planning, organizing. It's so much work for our committee. And you always try and find those moments at festival where you can just go and have a quiet moment and just, enjoy it and kind of be in that moment and love what's happening around you. And so I know for a lot of us, it's going and sitting in the kids' workshop in Carol's Corner and just kind of watching what's happening around you and knowing, oh man, we had part of this. It's pretty cool. It's a pretty neat thing to be a part of. And and it doesn't happen without volunteers. And, I think you'll probably hear me say all the time, volunteers give their time. And I think in life, that is our most precious commodity. Friends will come and go, money will come and go, but time is fleeting. And so when people donate their time and give their passion to work on something that they love, it doesn't get better than that. And I think Festival of Trees is the epitome of that.
If you were if the government or somebody just came up and said, Aimee, I've got $5 million, so just use it somehow. What would you do? What comes to mind?
Ooh.
That we need in Prince George that would kind of benefit everybody?
Oh man, there's so many needs. I think there's an argument right across the board. We need mental health beds. We need better supports for mental health. We need addiction supports. We need staffing supports. We need more staffing coming in. We need to close the cardiac gap. We need to keep cancer patients in the north. We need to bring stronger diagnostics to the north. There's so many competing priorities. That's a tough one. I think, I think I would have to I'd probably go process of elimination. We're getting the tower. We know cardiac will be in the tower, so I definitely we need support for that tower. Not for the tower in particular, but for cardiac in the tower. That's huge. And that'll be a huge piece that we need to work towards. And then also a PET scan. Those are kind of the 2 biggest ones that I see so many, we see so many patients that are affected by that. And cancer and cardiac are kind of our 2, they touch everybody. Yeah. And so support to either one of those causes, I think, are huge. But it doesn't take away from, we're working on a crash cart for pediatrics right now. And as a mom, you think of that and it's, yes, we need that. So there's a lot of equipment that we need.
Well, you touched on mental health, and is that something Spirit of the North works with?
It is. Yeah. Mental health is a big one. So we actually this past year, so going back 2 years, we had done, so at Christmas time, we always go around. Santa Claus comes down from the North Pole and we go around with him and give toys to kids in pediatrics and visit new moms in maternity. And we took Santa to our adolescent psychiatry assessment unit, which services all of Northern BC. And we went in that unit and we came out and we said, we've got to support this unit. What can we do? And they've got every department at the hospital has really great people that are looking at what they can do and how they can support their patients. And so we worked with a team in APAU, and they came up with a wish list of this full redevelopment of APAU and just creating a unit that really fosters putting supports in place for youth, giving them tools so that when they go back home, they've got the tools that they need to go back to their life. And so the incredible, last Spirit Day, we had an incredible donation from the Kiwanis team, the Kiwanis AleFest team.
Oh, yeah.
They made an incredible donation to our adolescent psychiatry assessment unit. So the equipment has started to arrive there. The unit is taking shape. So we've got these sound shell chairs that have come in, which remove, basically the youth can sit in them, and it's just this really calming space. So they help to remove youth from crisis when they're in crisis and calm things down. They've got projectors going all down the hallway that have games that'll be displayed on the floor. Again, you don't want a youth to feel like they're in a hospital when they're in APAU. We want to give them the supports that they need and the tools that they need to go back home. And so the equipment that they've brought in that they're working at putting in place right now is really making it not feel like an institution, making it not feel like a hospital, but making it feel like a safe place where they can get the help that they need and get the supports in place to head back home. So, mental health is a big one. I think it's something that we're going to keep seeing more and more and more of, and it's something that we really have to work to support.
Yeah, so many people just with different ideas too of how to handle a situation and so different from how we dealt with things as kids.
Oh, totally. And no one idea is better than the other. It's, I think it has to be very individualized and to figure out what works for each of us. And I know from a hospital, like from an APAU lens, it's just making sure that, it's there to treat the youth when they're in crisis, give them the supports that they need so that they can go home and continue to fill their tool belt with tools that they need to be able to function in their life. And it's a safe place for them. And it was just, I don't know, that one, it just holds a really special place. I know for me and a couple of members on my team, it's just got a really special place in our hearts to make sure that it's got everything that it needs to be that safe space for our kids. That's a huge for us.
Yeah. Do they have music there?
They do. So they've got these, one of the pieces that they've ordered is, I'm going to butcher this description, but it's so they wear headphones, but it's a drum kit. But it plays into the headphones. So it doesn't disturb the kids around them. They've got a guitar. They've got a drum set. I think they've got maybe a piano. I could be wrong with the piano. But they've got a couple of new pieces that are coming in. Again, just to, maybe teach a coping mechanism for a child. Maybe music is that coping mechanism for them, or is something new that they want to channel their energy to. Great. So it's just about exposing them to new things. So I'm really excited for that. I think it's going to be really cool.
Yeah. Those were exactly what I was thinking of when I asked.
Oh,
it was the drums or the guitar. Yeah.
They were so cool. And it was the team on the ground that run APAU saw this and said, we need to add this. And so they added it. And it's really cool. So we're the funders. So we're happy to say, absolutely, yes, let's do this. And then they take care of setting it all up and let us know when it's done. And we come in and just get to, and we've connected with the team pretty closely there to make sure that everything that they need, they've got. So we're pretty excited about it.
Nice. Yeah, you just think back to like think old history.
Yeah.
Right. You got your Mozart and Beethoven, right?
Yeah.
And then you got Van Gogh, who was painting. And now they kind of had mental health issues. Like if you look back at their lifestyle and things that they did. I mean, Van Gogh cut his ear off.
Yeah, this is true.
But that art kind of comes out, and whether that's music or painting, it
and it's funny, that was one of the things that they wanted to bring into this space was more tools for kids. So they've brought in different crafts for them to work on, to figure out, do I like painting? Is that something that I want to continue doing? Music, is that something that I want to continue doing? They've really worked hard at creating this space that allows them to figure out what it is that helps them thrive. And so some of the additions that they're bringing in, I just think it's not cutting edge, but it is, I think it's a little bit innovative, because it's not that traditional medical lens on it. It's also, it's this holistic approach of the environment and fostering a good environment. That's got a lot of weight and a lot of merit.
Yeah. And somebody who's just distracted in school might just need something like that.
Yeah,
right?
Exactly. And it just helps them connect differently, so that when they are out of that crisis and they go home, they've got those new strategies that they can pull on to hopefully help do better, and to keep those supports in place to continue to help them thrive. That unit services right across the region. So that's huge. I again, as a mom, I can't, if my child was in crisis and they were being sent to Prince George for care, I would want to make sure that they have the best level of care that they need. That would be very trying. So that's kind of the role that we get to play, and we're only able to do that because of our donors that truly make it possible.
Yeah. Cool. Well, Aimee, we've been chatting for an hour.
Oh, wow.
So
that was easy. I thought that would be way worse.
No.
It's like, I can't talk for an hour.
So if somebody kind of wants to volunteer or get involved with Spirit, like, how do they do that?
Absolutely. So we're always looking for volunteers. So we've got our website, spiritofthenorth.ca. You can go on the website. There's a volunteer section. You can sign up to be a volunteer, and we'll start reaching out to you for the different events that we have coming up. We've also got we have office volunteers that come in and help out with the office, answering phones and that type of thing. We've got event volunteers. We've got committee positions for festivals. So anyone that goes online, spiritofthenorth.ca, fill out that volunteer template, and we'll reach out to you and see what fits and see what you're interested in. And we'd love to have you become a part of Team Spirit.
Nice.